bankruptcy solves bad business decisions. This is a bad business decision. They made as good as they could. You sit down. And they made as good a decision as they could when they made the decision, and I appreciate that. But at this point, bankruptcy is the tool I would go through, you would go through, everybody that's here in business, real commercial business, you'd go through it, and it would be painful and agonizing, and you would feel guilty with your suppliers, but that heals bad business decisions.
Amen.
So,
Now, I'm the president of this outfit. I'm supposed to stand up.
Mr. President.
Yeah.
No, that's why we're having this discussion to get, I mean, you're gonna make the decision, you're the taxpayer.
Well,
You got
here's
the
something that was presented to me the other day. Well, if you don't vote for it, your house is gonna be less next year because nobody wants to move to this county. Most of the people that are gonna come to this county and buy and spend the dollars, they're not gonna use a hospital to begin with, they're gonna go right back to you. And then what he said earlier, I'm in the aviation world, so I can speak about it. He said, well, if the hospital closes, that helicopter will probably leave. That's BS. He's just going to fly that much more. Because how many people, when they go pick somebody up, how many people actually come back to the hospital? No, they go right to Austin.
I believe that the average daily occupancy for the last several years is a good bit less than 10, more like probably 5. I'm talking about 7 days a week. Bottom line, can the taxpayers of Fayette County afford to finance a charity hospital?
It's losing money.
Now that's my opinion.
I'll get you and then I can get it.
The management company that you listed is providing all these services, attorney services, obviously some kind of billing help, all of this other services that we are paying them this $20,000 a month for. Were they not around when the ransomware was, how if they're responsible for portions of our billing process, are they not responsible for the actions of whatever this software is? Were they not making those decisions at the time? And, I mean, you're paying them to manage, are they not managing the billing portion of do they not do a billing service for y'all too? The management company? The CHC, do they handle that?
They do, and that's the accounts receivable, accounts payable we were talking about.
The ransomware thing that y'all said, you drew y'all back up 2 years, and then the ransomware thing came up like 3 times. Okay, the management company's running it, they're hiring the IT company, obviously they're hiring the people that do the billing. That was their responsibility, but somehow the hospital lost money because of negligence on their part. Did y'all collect any insurance money for them to make up for the money that y'all lost?
Some type of,
I mean, if it was their responsibility.
they have to have some kind of errors and omission insurance that covers this kind of stuff. There shouldn't have been any loss taken by y'all for that.
I'm not an attorney, and I'm not an IT person, so bear with me. My understanding, because I wasn't on the board at the time, but my understanding is we got behind in our payments to the IT company. Now, if you get behind in your payment to Microsoft.
You said the management company was handling the IT people. Okay,
They do, but what I'm saying is, the hospital got behind on its payments. So you get behind on your payments.
On software payments.
To Microsoft.
So we have our own in-house.
You don't get the patch,
IT.
right? When Microsoft sends out the patch, if you hadn't paid your bill, Microsoft's not going to send you the patch. They didn't send us the patch, so our IT was vulnerable for the ransomware.
And who was responsible to make sure those payments were done or taken care of?
The hospital.
But what's CHC's obligation in that? I mean, they're no foul, no harm. I mean, that's what it sounds like. If we have a board managing anything, why would we do that?
And okay, all these services that they have offered, or that we're saying they offered, the attorney services and all this other stuff, how long do y'all project they'll have to stay on after the hospital district is formed? Because obviously, you're not gonna bring in 9 people that have no idea about running a hospital and go, hey, you guys figure out exactly what these people that manage 35 hospitals have been doing for the past 20 years in this long. How long are we gonna have to continue to pay them $20,000 to mismanage whatever they've been doing for the last however period period of time. I mean, obviously, we're gonna have, somebody's gotta be hired to do this, because there's no way 9 members that don't know anything
No,
about
I
that
mean,
are elected
again, I
by
agree with
the
you.
county
I
and
agree
come
with
in and
you.
run this.
No, I agree with you totally. And then again, I know you're being recorded, and I hope CHC's not watching this. I'm not a fan, so please don't leave this thinking I'm a fan. I've been on the board. I have voted against them. I've made recommendations against them. But I'm just a simple country surgeon who sits on the board. Okay? But again, I've been making stuff against them, so I'm not a fan. You're right. When this new board comes in, 9 members, I've already told some people in this county, like, don't think you can run it all on your own. Some people want CHC out of there. You know, when's the vote? June 13th? June 13th. But yes, so let me get to it for a second. So we did, I mean, some of these options, again, if people, you know, Mr. Zappalak, I think you're talking about some options. If anybody has the options, man, rjuno@hotmail.com, email me with whatever ideas and options you have to save the company or to save the hospital. Anyway, so we did, recently we went through, we know our bankruptcy, our structured bankruptcy fell through last year with the other hospital corporation. So when you talk about bankruptcy, that went, we tried it, it didn't work. We recently tried to go out and have other solicitors and all that. A lot of companies came in, and we're talking about Seton and some other companies came in. We'll be happy to manage you. We'll be happy to come in. We're not putting any cash in though. We're happy to make that management group. On my own, I went and spoke to some management groups. And just asking somebody off the blue that I just met was saying it was going to be $40,000 a month to manage the hospital. Okay, I can tell you, I don't know the numbers for sure. Back in 2009, when we originally signed with CHC, it was under $50,000 a month, but it was more than 20. That was renegotiated back in 2011 to that.
Do you have any kind of statistics on the amount of hospitals that they manage that end up in bad
No, I
debt
don't
and have
have
to be
any of that.
taken over
Don't have
by
any of that.
hospital districts?
Don't have any of that.
Okay.
Let me get the gentleman in the green, and then I'll get back to you.
I just had a couple of questions. First of all, I understand there's only like 100 people had to sign a petition to bring up this huge vote in the first place. What would it take for us to throw 100 people together to say, we don't want this thing and have it kicked out? You know?
You can't do that.
You know, to me, that's totally unfair.
We have to convince Fayette County voters that we have a better plan.
I need to finish though, and you covered a lot of it already with the bankruptcy. I had some of those questions too, but the fact that you would throw something together with 100 votes or 100 people on a petition, to me is irresponsible. And to do it in June, why couldn't we save the taxpayers $15,000 and wait till November? You know, we should have did that. Why are we yet working us further by costing us $15,000 in taxes? That already makes me vote no.
They have a reason. They have a reason for that because they're in bad shape. And I understand that financial burden and the force of their business. They need to make it. They need
And
to.
last but not least, is there another way to do it other than burdening property owners? Could you put a penny tax on, say, soda water and cookies for all these, say, fat people that run around and buy this stuff? You know, that goes to the house. You know, I mean, I'm just saying that. You know, but why is the burden keep falling on the fact on the property owners? That's what the whole big problem is. You gotta find, can we do a sales tax? A penny tax across the board? I don't care.
The sales tax is already maxed out in Fayette County.
So you cannot issue a sales tax locally, is that correct? Okay, that answers my question there, but still, again, it's too quick and it should have waited until November. At least that way they wouldn't have harvested it out.
The brochure that they sent out, it said that they needed the election by June, it had to be approved before June 30th to be on the 2020 tax bill. Well, they're going back to January 19, so when you get your 2020 tax bill, it'll be for all of 19. It's kind of misleading, I think, but, yeah, go ahead.
Do you have the wording of what's gonna be on the ballot? And the reason I ask is when you look at the Texas Health and Safety Code, it lays out the process that y'all follow. Exactly how you go with the 100 vote or the 100 people, you get to go to the county and all. But in that, it also talks about the board may issue general obligation bonds as provided by subchapter G. If a majority of the votes cast in election favor creation of a district and issue of bonds. So what is the verbiage going to be on the ballot? Does it have anything about bonds? Because you may not end up with taxes, or you may with taxes, But if the verbiage is such, you can get bonds also.
I haven't seen the final draft of the ballot. The attorneys are going back and forth with it. But I don't. But I think Terry Hester, you know,
Hang on just a minute.
I think Terry Hefner, her name is, who's our election coordinator, she's working on a draft for the ballot. So, if you wanna give me your email, as soon as we get it, we'll send it out.
Yeah, it's on the list. Yeah, I'd like to know because that bond issue is out there too. If you wanna go on the computer, look up the health and safety code, it lays the whole thing out, exactly the way y'all are going. And I don't understand, we've been in trouble, obviously, since 2009 or so, but yet we gotta have this crammed down our throat the last 90 days.
Right.
Without a strategic plan, or what you're gonna really do to move forward, and there's a hospital down the road that's making money, but yet you haven't gone to see what they're doing, it doesn't make all good sense to me. I'm sorry, I don't wanna lose the hospital. Hell, I'm of the age I probably need it more than a lot of people. But it doesn't make sense, the process we're using. I mean, it's like the house is on fire and I gotta put it out instantly, rather than doing some of this homework by the board, by CHC, by somebody to give us the plan. When I get the $3 million a year, what is gonna change? So when I go to the ballot and say yes, I'll have some comfort that there's a plan on how you're gonna use my money to save the hospital. I don't have that comfort. I gotta get it before the 13th, or I gotta vote no. Hell, I don't buy a GM product anymore because they took my tax dollars to bail out GM because they were too big to fail. So I buy Fords from now on because they didn't take any of my tax dollars. I'm stupid, but that's my mentality. I'm sorry.
Amen.
Hey, Mike, how many years are left on the mortgage? Are we down to 10 years, 15 years? Do you know?
I hadn't looked at it specifically, but I think we're halfway through. I think it was a 30-year mortgage.
Okay. And why are they doing the 10 cent or possibly 25? I think it'd be an easier sell if it was just 10 cents and that's it. Why did they put a 25 verbiage in there also?
The Texas statute, because again, I'm not an attorney, okay? The Texas statute requires that the petition have a specific number cap.
Okay.
So that's why it's 25 cents. That's the cap.
So next year, if it passes, then next year it'll be 25 cents, is what you're saying.
The newly elected board of local members from Fayette County decide.
Has that board already been chosen?
No.
Have there been people named to be on that board?
No.
Well, why can't, and that's, I mean.
They are appointed by the commissioners,
Yeah.
2 from each precinct, and then 1 at large.
So nobody's even been considered or anything else?
Oh no, they've been considered, but we don't have any names.
So the board will determine whether the tax rate goes up.
The board determines who actually, the commissioners appoint the board,
Yes,
and then the board determines the rate.
the rate, the tax rate. So they
So
need to do that
the
themselves.
board will not be accountable, they won't be elected. The commissioner's elected, but the board's not gonna be elected by the people.
They'll be appointed for 1 year. It's a temporary term. The appointed board members are 1 year, and then after that, in the normal May election, they'll be elected like a school district board, or the mayor of the Grange.
So then they're re-elected every year?
No, they will, when they're elected, they will serve 3-year terms.
I think they do like a 3-year staggered term or something, so you don't.
But this original appointed board will be 1 year.
What makes commissioners qualified to figure out who they're gonna put on the board?
That's a good question.
Voters to do that.
Thank you for my question.
Well, okay. What? I need to finish while you're. So you
Well,
said.
hang on, let him answer, what makes the commissioners qualified to appoint board?
Yeah.
It's a good question. My understanding is the Texas healthcare statute.
That still don't make them qualified.
I agree.
Okay, go ahead.
Y'all said y'all did go to Seton and they said it was $40,000 a month.
No, I didn't go to them. They offered to manage us.
Okay, assuming that this does go into a hospital district, granted, these 9, and obviously the 9 members are not gonna be able to run this, we will have to have somebody that manages this, because there's no way it would sink worse than it is now. Okay, so we can assume that we're gonna pay at least $40,000 a month, because nobody in the right mind is gonna stick with the management company that has currently been running it, that
Apparently they have.
hasn't been doing correctly. So, how long, y'all being on the board, do you assume they will have to stay as a management company at $40,000 a month? I mean, that's taxpayer money.
You're talking about the new group?
Whoever's gotta come in. I mean, you've been on the board for how many years, did you say? How many years have you been on the hospital board?
I joined in December 16, so 2 years and 4 months.
Okay.
I served on the hospital foundation, which is the group that raised money in support of the hospital since '99.
Okay, well, in your opinion, for the 3 years that you've been there, how long would you assume that this management company would have to stay in operation to keep this hospital afloat at saying we do take care of the debt and it does make money? How long would they have to stay there and us paying them $40,000 to make it where someone will learn to run this operation?
Well, again, the current payment to CHC is $20,000.
Yeah, no, I understand, but $20,000 to somebody that's not running it correctly is I mean, it's not efficient.
And I don't think you can, I don't know, I don't think anybody can answer that question.
Yeah.
Now, if you, like currently the setup right now is that our administrative or C-suite are CHC employees. I think if we left, I think in their contract, they do not have non-compete agreements. So if you're looking at, I mean, the future, I'm assuming, and you know what that means, is that the new management company would do the same thing as far as hiring the administrators. Now they would probably, if they're the big companies, they're gonna have non-compete. So how do you teach somebody to learn? I don't know. I mean, if you know of a great CEO in your back pocket,
we can also assume that we're gonna have possibly a $40,000 liability a month for a management company. Also, along with the $140,000 note payment, however you break down the $2.3 million in debt that we have to take care of to the previous management company. I don't know how that breaks out, but we can assume that $40,000 is gonna be in there too, because there's gonna have to be somebody managing it, correct?
unless the new board, elected board, or Fayette County residents know somebody who can run it, they can hire them.
Go ahead.
In all the years the hospital has been here, has it ever actually made a profit?
You're talking about the current hospital, St. Mark's Medical Center?
The hospital board you're talking about, yes. Why would I pick one out of nowhere?
Well, with all due respect, as I mentioned earlier, there's been 3 hospitals that we serve.
Okay, but we're not talking about those. We're talking about St. Mark's.
Since
Medical
05,
Center.
since 2005. That was the date you gave us.
I think it was June or July the 11th.
It was July 11th of 05.
Okay.
Without financials in front of me, I believe that it has been profitable, but I cannot tell you a year or a time.
Okay, I'm going to take that as a no.
Okay, gentlemen, back.
I'd like to make a couple of comments. One, it seems ironic that the state legislature is wrestling with property taxes, and we're sick and tired of paying the damn thing that go around every year. Excuse me, the timing is really bad for this exercise. Secondly, management compensation should be based on performance, not just a handout. They should earn it. And we're losing money, they shouldn't be paid $500,000 a year, excuse me.
Well, they're not being paid that, Paul. I think he said that was a part of their total compensation for 27 operations.
And the other question is, what is the relationship to St. David's? Have we inquired about Scott and White? Some other people that might be interested in working with us to get us out of this quandary.
St. David's is a clinical affiliate. In other words, and the doc can tell you better than I. It relates to direct transfers, continuing education, patients being moved up to St. David's. It's a clinical affiliation. We have talked to all of the key players in healthcare in Texas about our hospital. Pretty much anybody you can name. Seton, Baylor Scott and White, Ascension, St. David's.
But they're sitting there, being, I guess they couldn't buy y'all out or could come to a deal, so they're gonna sit here thinking, all right, they're gonna go bankrupt, and then we're gonna come in, and we're gonna take over, and we're gonna run it for a profit. We're gonna make it work. So apparently, these people know what they're doing versus what we've got going on.
That's
Because if they're willing to take it over, they're gonna make a profit. They're not, those, I don't care whether they call themselves non-profit or profit, they're still gotta make it, put it to black.
Operation, right?
And Dr. Juno dismissed bankruptcy a while ago. You
I'm
said
sorry?
we can't, you couldn't file bankruptcy?
Well, we couldn't file Chapter 11, a structured bankruptcy. So you had to have a partner or a plan. We tried that last year, and that's what fell through.
Structured would mean we have a plan going forward, we know how we're gonna do it, and we absolutely can prove in our own minds that it's gonna be profitable. And structured bankruptcy is really tough,
And you have a buyer.
and you have a buyer.
So we tried
That's
that.
the
There's other kinds of bankruptcies, right?
Tried Chapter 7 would be the other one. Chapter 7 would be total liquidation.
Well, yeah, we're supposed to be like, yeah, I appreciate that.
And the idea from someone who's involved in healthcare, as far as these corporate, the corporate entities out there, there are some I do not recommend and I would not want to work for, and I would not recommend anything. Baylor Scott and White being one of them. So their plan is they will come in here and probably close the place down. Because again, they just built medical school, all the other stuff up in Bryan College Station. So they're trying to feed them. Belleville has St. Joseph's in there. So St. Joseph's is having a lot of financial trouble. They overspent. They came in and bought St. Luke's Hospital in Houston. Have been losing money for about 18 months on them. They just had a total corporate restructuring, or their CEO and all that were fired and let go. So they didn't want to look at us. But again, looking at Belleville Hospital, which is a district and was managed by St. Joe's, they were pulling everything out of Belleville and bringing it all up to Bryan College Station. So the local docs were getting upset because their patients were getting upset. Who else? So anyway, I wouldn't want to work for those. I mean, I might work for the one up in, or I'd be happy to work with St. David's. They've been good to us since we've been here since 2013, but they looked at us and, yeah, they're probably waiting. But Chapter 7 is we have no control. Even when I say we, I'm talking about as a Fayette County resident. We don't know who's going to buy the place. But that's what it would
Highest
be.
and best use is a hospital. I mean,
What's that?
It's highest and best use.
No, I understand that.
Nobody's gonna come in and turn it into a big convenience store or a mall. Or
No, I understand that, but you have no control over,
Somebody's
again,
gonna buy it. and
but
they're
the
gonna
Scott and
work
Whites
for
and
it.
those kind of things who are corporate, who, medical doctors do not, they're not very good. They're good at making money, but they're not very good at healthcare.
Before, I'll get to Tom in a second, before y'all leave, we're forming a grassroots organization in opposition. If you want some more information, come up here after the meeting and we'll talk to you. Okay, go ahead, Tom.
If we pass this district, will it make it more attractive for another hospital to come by us?
Yes, I think so. If you looked at, we had numbers, and I apologize, I don't have numbers, but of all, our recent article came out about all the rural hospitals across the country and in Texas. The ones and they ranked them critical for closure, doing okay, and so forth. The ones who were doing okay were all hospital districts, or headed districts. So yes, that's what we think as a board, and we went through, had a consultant broker look at us that just said, yes, if you had this district, you'd look better.
And the more,
What's our new board gonna think?
the better it looks.
I'll ask you.
So I guess my question is, the only thing you can tell us is you want our money. You're not gonna tell us how you're gonna use that money, and that's what I have to base my vote on. Is
I mean,
that correct?
if I broke it down this simple, I'm a simple surgeon. I'm not a financial
No,
expert.
but I'm just saying.
So I would say right now, what I see from the financials every month, that We do pretty good until we write that mortgage check.
So
So,
you're not doing good. I mean,
well, again, you're asking me to be
yeah, but I
honest.
mean, I understand.
You want me to be transparent and honest? I'll be honest.
No, I understand that, but I mean, it's okay. I'm making money till I have to make
Okay.
a balloon note. It's my company.
Okay, I mean, you want me to tell you? I'm gonna ask you.
As the taxpayer,
So we've made-
what I'm voting on is basically a yes or no, you get my money and you decide what to do. That's what you're asking me to vote on. You're not giving me a plan. You're not giving
But
me
again-
any information. You're just saying, once I get your money, we'll make some
They're gonna pay off the
determinations.
debt.
And then
We're gonna
we'll
use
see
it,
how it
it's gonna pay off,
goes.
like you said, so it's gonna pay off the debt. You're asking me about a plan from a board, and I don't know what's gonna be there. Now, whether we spent another year on this, you're still not gonna have a plan come whatever that date that finally gets put on the ballot. Do you understand? So there's a whole new board.
When I think
The whole
about
new board will
business,
be in
you
control.
have to have a plan to open a business. And this is a
Okay,
business deal.
this is a district.
And so as
This
my
isn't a business.
So basically, you're asking me to say yes or no to taxes, that you're not gonna tell me how you're gonna spend them, or any guarantees in those taxes.
So
And then
again,
I have to
if
have
you
the-
listen, we've talked about it, financially, the balance sheet looks okay until we write that big check, so that will help. The 3 million will at least
But
cover
you're
the
not
mortgage.
gonna-
Can you
but
listen?
what I'm saying, I want the business plan that says, okay, long-term, how are we gonna come up with the extra money to float the hospital besides
Okay,
just
I don't know,
tax
whatever your name is,
dollars?
we'll get you on the board and you can draw that plan up right there tomorrow. We can't, I don't know what the plan's gonna be because, first of all, you don't want, again, people are saying they wanna get rid of the current administration and the management company. Well, our current board is part of that. So we're going away.
The gentleman,
This is your chance to come up with stuff.
gentleman in the back.
And I just want to make a comment, after looking at everything here, observing, and the last few days, learning and picking up a lot of information. It seems to me that the hospital district here has tried to interest other people in buying. I'm using that term.
Well, when you say district, the current board, hospital board.
I'm talking about the hospital board here that you represent, has tried in the last several years to get somebody else to take it over. And you've been unsuccessful, and now you're asking the taxpayers to buy it and sign a blank check.
That's, yes.
And that's it. I'm not gonna sign a blank check, period. I am not in favor of it, I'm totally against it, and I'll go to my grave.
Well, that's what I was asking. I want the information. I wanna know, what am I saying yes to, and what you're taking my money to
What
do,
is-
and you're saying you can't tell me that.
What is the value of the building and the land?
Difficult.
I mean, that was, I don't think we really have an answer, because we haven't had an independent, because, like I said, we had other people, other companies appraise
Is
it.
the audit done or anything?
I think we're trying to do the land.
But the building and the land has some value. There's land out there, you've got more land than what you need.
No, we did we get an appraisal on that?
We don't have the city of LaGrange has an extra $7 million. Couldn't we sell that, couldn't they buy it, couldn't we sell it to them? Wouldn't that ease the debt on it and make the, technically could make the check only $70,000?
Right, and that's one of the things that we're doing is as a board, current board, we're looking at different options. We're in contact with some local banks to see about getting financing against some of the land that we have that's not collateralized. So in other words, the hospital and a chunk of that land, I forget if it's 23 or 32 acres, is collateralized for the mortgage. But there is some land that's not. Commercial land in and around the Grange could be 50,000 an acre on the low end. Some of the higher priced stuff is 100,000 an acre. So we're gonna look at some possibilities. The other thing I want to mention, young lady, and this is addressed to you, please, is that we came here tonight because we heard there was a meeting and we wanted to answer questions.
And I came to
We
my
did,
business.
amen, but we did not bring any information. So please bear with us because we came tonight just to be nice. I had brochures, that was it. So
I was leaving church and found out about the thing, and so.
And I'm glad you're here.
I'm just as unprepared as you,
Yeah.
because this is not an informative platform that you guys are using to the taxpayers.
Yes.
That's my issue. I'm leaving church and I find out because there is no platform to share the information that you guys have, but you want my money. You want me to go into business with you, but you're not being upfront. You're not gonna have a town hall meeting?
Who told you that?
Well, where is it scheduled?
That is completely incorrect.
Well, where is it scheduled?
It's not scheduled yet because we.
So as of right now,
Yeah, attorneys
before
and ballots,
the early
we're gonna be
voting
making the ballot
starts, there is
before.
no town hall meeting to get my answers.
Like I said, this
You're
meeting
asking me to
tonight,
vote before the answers can be given to me.
this meeting tonight was kind of, it was more of a committee meeting for the group to get our plans together, but it got out there, so we went ahead and had it. We didn't have any information either, but the discussion that y'all created is what we're after. So we're gonna have some more meetings ourselves, so.
And we're gonna have town hall meetings throughout the county.
We're all learning something, both sides. Y'all are learning the answers y'all need to come up with the questions that we have.
The only statement I saw this meeting was on Facebook in the beginning of the Facebook posting was attention Fayette County residents. That didn't say close the meeting, that to me was everybody. It was
Yeah, it kind of got out there.
It did not say close
But the
the
hospital
meeting.
board didn't call the
Attention
meeting.
Fayette
Our
County
group
residents.
called, yeah.
But that's how, you know,
Will you come to the next one?
I will.
I'd pay the $650 to see it close.
Yes, ma'am.
Okay,
Because
today's
the only
May
experience
1st.
I've ever had was I thought the guy was gonna die before they ever looked at him, and they knew I was coming.
Go ahead.
Okay, today is May the 1st.
Me? I wouldn't go that high. I'll sit at the range.
May 28th.
Today is May the 1st. The vote is set for June the 13th.
Well, the May 28th, you can start voting.
I know that, I know that, okay? But May the 1st to June the 13th, and we're gonna have town hall meetings, and we're gonna have this, and we're gonna have that. That's a really short window of opportunity there. So we need to get something put together. Okay, so when's that gonna happen?
Well, we're gonna have another meeting probably within the next week, and we'll probably have 2 or 3 more meetings, our group will, but I can't speak.
We're
for my
not
life.
allowed to have
All right, I'm with your
closed
group.
meetings in this building, okay? So if that answers any of your questions. We were not allowed to close this meeting this evening. Because you're in a building that you're paying for.
And Ken and I are the only ones that ever been kicked out, and Larry Jackson and Mark Ivy.
Yes, but according to Judge Ed, this is a public building and it's open to everybody. Okay?
Yes, sir.
So I'll bring
I
some
don't
update.
know if I read this correctly in the paper, but I thought that I read that in the event that $3 million is obtained, that a $2 million payment is gonna go to the hospital management company, and anyone confirm or deny that? Is that the correct information?
I read that all.
So there is, that's what they brought up, that's the debt that we owe, that St. Mark's Medical Center owes CHC Corporation. How that gets paid off, in the paper, the number again, don't, look at there is in the frequently asked questions that Mr. Corker has, $2.4 million, not to exceed $2.4 million. Okay? When the new board comes in, negotiate it. It can go down. They can decide how are they going to pay it off. You know, is it going to be off on payments? Are they going to stay working while we pay it? So that's up to be determined by the new board. Me, if I was on that board, I would go to the drawing table and say, yeah, let's talk about it. You know, I'll give you $1 million, get away, go. And how it gets, then we'll decide how it gets paid.
So
that's what that is.
That company is on the table if this.
Well, just like all of our other vendors.
Right.
So we still owe other vendors money. We're on the table for them.
Do you know what your total debt is right now? Do you have any idea? Including this mortgage plus the vendors plus, I mean, like, what would it be?
Accounts payable changes every month. I mean,
Sure,
Stryker.
but there's usually, there's an average accounts payable out there, so what would that be on an annual basis and, you know, with your vendors and?
It's like, I think it's like just over 3 million,
About
including the
3 million.
2.4. Yeah. from the-
Okay, and then the 15 million in the mortgage.
Correct.
That you owe, is there any other outstanding debt?
I don't think so.
That's about it, okay.
So I'm gonna take Tom's question, and then we're gonna wrap it up, and it's starting to get late here, so go ahead, Tom.
Yes. Couple $100,000. We can help a little bit.
Here,
I'm just gonna make one comment again, just as a physician, okay, and a county resident who's been here. Sorry, I grew up in Louisiana, but got here as fast as I could. Is that what the bumper sticker says. Went to college here, went to medical school, went away for my training, but then came back. I'm a surgeon. What's that?
Married a wonderful person here too, didn't you?
I'd like to think so. I mean, I don't want to spoil her name with being associated with me tonight. But, so, anyway, but, yeah, I came here, moved here, bought a house, raised my kids here. My plan was to live here forever. Okay, this has been a total change for me. Healthcare has been a total change and a total disappointment in my life. So maybe that's the biggest mistake. You know, how many parents out there would say, or would be proud to have their kid go to, you know, medical school? I actually think it's a big mistake. I did the wrong thing. But anyway, don't knock all of my people like me because you hate the ER. Okay? 90% of what I hear complaints about with the St. Mark's Hospital, I'll talk to you if we need to. I'm not here to defend them. But don't hold me accountable in what I do based on what you think about in the ER. All right? I don't know, total business, I mean, how much business gets done just from the ER? I mean, 50-50 or something like that. So if you can put that aside as a business plan, why don't you start keeping what we do well? We do some things well here. If you were transferred or if you were offered transfer, it's because we know what we can handle and what we can't handle. And why would you want us to do something that we can't handle? My grandparents grew up in rural Idaho and then also in rural Nevada. I would go visit them. When I was in medical school, they were frustrated. They got sick, they were old, they finally retired and died in rural Nevada. But I would go visit them. My grandpa would complain about, I have to go to the doctor all the time, all this stuff. I can't understand my doctor, all this kind of. So I thought rural people needed a good surgeon. I trained at one of the top 3 programs when I applied for residency in the country. I came here saying I could do anything. And I still can operate and do anything. However, I can only do what my hospital supports me to. So yeah, I can do a cardiac bypass, which is open heart surgery if I want. I can crack your chest open and do that at the hospital, but I don't have any help behind me. So why would you want me to do something that I can't support? So if we make a decision, if I make a decision to send you off, and I've got no ego on my shoulders or any of that stuff. I turn down more surgeries than I actually do. Because I know what I do, it's best for my patients. I'm not in to make money. Yeah, I need to pay for kids next year to go to starting college. But I'm not going to do what's wrong by you. So don't hold those decisions made by a select few on everybody else.
Okay.
And close your hospital.
You just said that your hospital is not behind you.
Well, I mean that in...
But it's okay, I understand what you're saying.
But I mean it in that, should we be doing transplant surgery in LaGrange, Texas? No, we shouldn't.
No.
Should we be doing cardiac bypasses? No. But let us do what I do and what we do good. Let us do that. Don't sit there and go, well, I want to get my colonoscopy in Brenham because, you know, I'm going to drive the extra 30 minutes there because I want to go to Academy and my wife wants to go to the mall or something like that. Fine, if you want to go drive the extra half an hour and shit yourself in the car, fine, you do that. But that's what I'm talking about.
What we need here, though, is a really good ER, but that's what we don't have. My experience there, too, were very negative.
Well, again,
if it weren't
my
for
number
Houston
is
doctor,
open. My number is open, okay? I mean, I don't have cards. I was just called at the last minute. I'm working today. I mean, I covered the ER. I will go to the ER and see patients.
right,
But if
I'm
you
just
can
saying
give
that's
me-
where it seems like we have the problem.
Everybody tells me they had some bad experience. But I do sit on the board, I'm chief of staff. Nobody gives me a name and allows me to go look up that thing so I can find out an incident. Just had a patient, I don't even know what it's today, Monday, and I talked to Miss Quitta. She is now covering, she's our charge nurse, great charge nurse, been with St. Mark's and even Fayette Medical in our floor. She's taken over now the responsibilities of covering the ER, okay, as from a nursing standpoint and all that. She's done that to control costs. Now she's doubled her job, and trust me, that's probably more of a headache for her to begin with. But I just went to her Monday, a patient of mine came in, said the same thing. You know, Dr. Juno, he saw me for a colonoscopy, needed his gallbladder taken out. He's like, and he didn't want to tell me about it. He felt embarrassed that he went and had that done somewhere else. But he had a family member who had a bad experience. You need to tell me what this is. I can't change it. I can't research it, I can't look into it unless you tell me exactly word for word what happened. So I gave them, again, email and cell phone number and said, go ask your family if it's okay for me to give you that information. So I'll do that. Do we need a great ER? Yes, we do. You know, again, 50% of our patients go through there. That's their front door first experience.
I
But I'm not an ER physician.
That's the Achilles heel,
Okay.
I think, in the hospital.
St. Mark's is
One more
not
comment
failing,
from this
St. Mark's
gentleman,
is
we'll wrap it up.
succeeding as an institution. I've had contact there, I've had contact with my mom, I've had contact with others. It's succeeding as an institution. It has a desperate census problem.
Well, again, just to address the census problem. So, this is government math, all right? I remember, like, for some reason, they miscalculated my taxes and said I owed something on like a 1% or 10% annual basis, but then I get charged 15% over 2 months. I don't understand how that works. So the government thinks that spending 2 nights in the hospital is outpatient surgery. So just let that sink in. I don't know, okay? So there's been a push since Obamacare came in 2008. They don't want us to keep people in the hospital, okay? And if you think St. Mark's is bad, then go to another city, the bigger hospitals, and see how much they squeeze that down. So we technically, I mean, we get penalized for keeping people in the hospital. So the census now is down. But if you look, so inpatient census 2009 was up here, outpatient surgeries and outpatient procedures were here.
So you're saying the
Now we
statistics are operating against you, but the reality is you're still covering patients.
We're still covering patients. We still have to see everybody that comes through the ER. You cannot turn them away.
Those patients don't count on the census. is
I
what you're
understand.
saying.
And so again, when somebody brought up dish payments, okay, dish payments were counted or tabulated based on days in the hospital. It didn't matter the number of patients, it wasn't on the procedure. But you have one hand, you know, this is especially for deliveries. Okay, how many young women, or how many gray-haired women remember you had a delivery, you had a vaginal delivery and you stayed in the hospital 5 days? Okay, now you stay in 1 night. Okay, we're not going to talk about how that's fair, but that 1 night doesn't count now. So most of at St. Mark's, most of our dish payment comes from Medicare patients, and it counts Medicare nights. However, that first night doesn't count. So we're being forced to get patients out in 24 hours. You see how that stuff. So again, what's happened in the past happened in the past. Did we overbill? Yeah, we did. I'm sure if we had this, you know, if we could go back in time, we could sit there and change everything. We would do more outpatient surgery. Maybe we could have an ambulatory surgery center or something like that. Closing or shutting down or changing the numbers. So I think we're licensed technically, right, whatever it is. So if we drop that number, well, the government says, again, CMS, Medicare says you have to reapply and we have to do all our regulations all over again. And we would probably lose some benefits on that stuff. Somebody asked about, I know people were talking about nursing home or assisted living. It's not assisted living, wouldn't be something in a hospital setting, right? You don't want those people around. But we are bringing up different ideas on that stuff. But again, it's going through the regulation of taking those beds off the hospital. And now we got to go, again, a hospital that was built in 2005, especially nursing home. Now we got to go turn those over. We got to reapply, get all the regulations now in 2019. And whether it meets code for a nursing home. So I heard that's been that would be very difficult. This is one of our attorneys talking about all the regulations that would take. Yeah, I mean, it's not going to turn into a car dealership or something. One thing, again, going through bankruptcy, some of these groups that would look at us, they would preferably like us to stay open. Because once it closes, you have to reapply for all that. And even, again, rich corporations get rich because they don't like wasting money. It is a hassle to reopen all that stuff over again. But anyway, I just say again, support us and support the docs. If you want to do that.
One more final one from Doug, and we're going to wrap it up here.
Okay. I understand your reasoning for wanting this vote to take place on June 13th so you can start charging the extra taxes this year, but what would be the consequences other than you wouldn't get the year's worth of taxes to delay the vote until November, give everybody an opportunity to really understand what's going on, not an option?
Again, it goes to 2021. We will not be able to collect any cash until 2021. So now we've got another 18 months.
As the doc said, we had hired bankruptcy attorneys last September. We're that close.
Yeah.
Chances are good, with the summer season not being good financially for hospital, chances are good we could be right back in that same boat. My crystal ball is kind of foggy, Devil. I can't guarantee that, but that's why when we read the statute, the attorney reported back, we moved forward as quickly as we could to put it on for June, because if we don't get the funds this year, it's highly unlikely we survive.
One more question on the makeup of the board that the commissioners are going to appoint. It sounds like there needs to be the average citizen on there, and it needs to be somebody that understands what's going on, like you, Russell. It almost seems like that we need to start talking to county commissioners about this whole process also, because they're involved in this.
Wait, are they
If this passes, they're involved in it.
each board has to have like this, you know, a certain representation of like professional, medical professionals. A lot of boards in some businesses make sure that, you know, there's one woman, there's one man, there's, you know what I'm saying, is there gonna be a regulation,
I
or
don't
is it
think
just
so.
whoever ends up on it is?
Well,
And
again,
if there's no
it's the
medical
initial
person,
one.
there's no medical person, and if there's no taxpayer, there's no, is that?
Yeah,
is it
being
just a
open, I
random board?
personally have not talked to any of the commissioners or any of this about anything. I don't think we've seen, I've not seen a name or any list. I've heard people talk. So there are some people who have talked to the commissioners, are bringing up names. They have said they would like, that they brought up, again, nobody's asked me, but maybe they keep a board member or two who's already been on the board. I think that would be smart, just because they know what's going on and they can bring.
How many board members are there currently?
I think it's 12. And out of those board members, you have, one of them is the CHC member. One is a St. David's member. Remember, we have a clinical affiliation with them. Now, he has recused himself. He's not been on the board for over a year now. But the other ones are self-appointed, different things, bankers, people, business members, those kinds of things. I'll throw Ms. Morris out there, she's on the board too.
But Tom, back to your comment, we absolutely recommend talk to your commissioners, talk to your state elected officials. Healthcare is a mess.
Well, we don't have that much time.
We are not alone.
Quite honestly.
But I'm talking big picture, Rita. I'm not just talking about this specific
We only have
incident.
until like June
Yeah, with the
13th to make
commission.
this decision, and I think you don't have a very good chance of it passing, because number one, people don't have time to get the information that they need to make an informed decision. And number two, people are very angry right now because they feel like this has been thrust on them. But I feel like if you delayed it to November and you educated the community and the county, that you would probably have a better chance of passing.
So being naive about this, again, there are examples of these districts closing.
Yes.
Okay, in Indy. Yes, it's my tax money too, but it's like, I think this is a shot that, in my opinion, it's a shot. I'm not speaking for any of these guys. So, we have to do it. If it doesn't work, yeah, maybe I'm out a couple $1,000 for the next couple of years, but if it closes, it closes. The district will go away. The taxes will go away. Can't go into the general fund, it's not gonna be there for the district. Now again, we have to suffer the consequence of what that means on other services around.
But the district rate could continue to go up to 75 cents a hundred before you.
But it has to be another election.
Yeah.
That's right, but
They go up
before,
to 25 cents based
then
on the
you would
district vote.
declare to dissolve the, hospital district.
I don't know, maybe.
Well, that's the trend in Texas from what I've
I can
looked
tell you,
at.
I think some of the districts that are working now, the ones that we looked at, I think it's around 20 cents. There's some that are like 18,
Well, there
one
are a
that's
lot
like
of them that
21.
are in the 30s and 40s.
Well, the ones in
and,
Texas that we were looking at were around the 20s. Let me see some.
Well, Matagorda County's already 34. There are a lot of counties that are in the 30s.
We gotta wrap this up.
Now, my opinion again on the management companies, I think we need to get, again, I don't think CHC is gonna be here in the long run, I don't know how quickly, but you gotta be careful cutting them off right away, because they do hold some cards for us to transition or whatever. I think they have been amenable to helping with that transition. I would like to see us be a part of some kind of bigger group. Okay, it doesn't have to be St. David's or something, but I mean, I would like to be part of a group that's managing and maybe managing a couple hospitals that we could sync up with. You know, looking at, I know everybody's gonna bring that 994 with salaries for CEOs. Do we need, does every little hospital need a CEO? Maybe not, but if we're part of a group who knows how to manage it, maybe managing a couple of hospitals, the CEO managing several hospitals.
There are some cost savings.
So there are other ways, getting back to the plan, there's things we can do, I think, you know, the plan, but we're not doing that right now because again, we can't tell you what your plan is gonna be because that's CHC's plan.
One of the things that aggravates me, it's not y'all's fault whatsoever, but we've got people voting that owns nothing in this county that's gonna vote for this thing, and they don't have a dog in the hunt whatsoever.
That's America right now.
I know. So I still can get aggravated.
I'm aggravated too.
But, you know, and like he said about bankruptcy, I'm younger than a lot of the people here, but I was taught that bankruptcy, you owed that debt till the day you died, period. There was no absolution, nothing. You owed that debt and your children owed that debt. That's the way my family was. And I hate bankruptcy.
I'm gonna wrap this thing up. Our group hopes to have 2 or 3 more of these forums in Grange, and we're gonna try and do a couple, you know, may go to Schulenburg, Ellinger, Round Top, spread out around the county so people don't have to drive this far. So just be watching. The next one will be advertised a little better, and then I assume the hospital board's gonna have some forums or things, so I guess they'll announce when they're gonna have theirs. So
What's the name of your group?
we're so new. We have
anti-everything.
We haven't even had a chance to give a name. So.
It could be called A Better Way. I wrote out a little bunch, but there's my little submission. A Better Way. I mean, and it's not an easy thing
Well, I
to
want to
say.
thank y'all for coming. This gentleman's got a question.
Can I make a suggestion, if you're going to rotate this, that you have the commissioner in that area there, so we can pin them down and see if they're qualified.
The next commissioner board meeting is
Y'all want to watch your commissioner's board
May 16th.
Thank y'all for coming and joining us.